Hi, welcome to another episode of Ask Dr. Richard. Having a newborn baby at home can be quite exciting. However, if you are a first-time parent, you may have many questions that need answers too. And in this video, that is exactly what I'm going to be doing. Your baby's only source of nutrition is through the breast milk that you provide your baby. Ensure you breastfeed your baby every 2 to 3 hours every day in the first 7 to 10 days. Subsequently, you may feed your baby on demand. Remember that in the first few days, your milk production may not be as much as you would think it should be. So the first few days, there's a lot of colostrum that is produced, which is rich in fat and protein. And this is usually enough to satisfy a baby. Remember, the more often you feed your baby, the greater your milk production will be. So remember, always feed your baby every 2 to 3 hours. Do not give your baby anything else. And remember, after the first 7 to 10 days, you may feed your baby on demand. Your baby needs to be kept warm at all times. So ensure that your baby is swaddled nicely. Also ensure that your baby wears a cap, gloves and socks. Remember that the heads of babies have a larger surface area and therefore they tend to lose a lot of heat. So always ensure that your baby wears a cap. The room temperature should also be pretty comfortable for the baby to sleep in. So preferably keep the temperature between 20 to 24 degrees centigrade. Ensure that the room is dimly lit. There isn't too much noise around. And also ensure that in the crib where baby is kept, there isn't any loose clothing or blankets, because this can cause some obstruction to baby's breathing. It is normal for most babies to lose weight in the first few days of life. A weight loss of up to 10% of their birth weight is quite normal in the first 7 to 10 days. Subsequently, babies start regaining their weight and reach their birth weight between the 10th to the 14th day. And thereafter, they start gaining weight at an approximate rate of 20 to 30 grams per day. The umbilical cord needs to be kept clean and dry at all times. The umbilical cord stump usually falls off between the 7th to the 10th day. You should visit your doctor if you notice any discharge, any foul smell, any bleeding or any redness around the umbilical stump. Jaundice is quite normal in all newborn babies. It usually starts from the 2nd day and can keep increasing until the 7th day. So normally jaundice starts in the face, so you would first probably notice it in the eyes, over the face, and then it gradually progresses downwards. Jaundice over the face is quite normal, so there's nothing to be alarmed about it. It may even remain, as I told you, up to the 7th, 10th or even up to the 14th day in some babies. Always keep a watch for jaundice in the baby's palms and in the soles. So if you notice any yellowish discoloration in the baby's palms or in the baby's soles, in that case you need to immediately visit your doctor and get your baby examined. Baby should always be placed on their back while in the crib. Side sleeping or sleeping on the tummy is strongly discouraged because there is an increased risk of sudden infant death syndrome. Also avoid co-sleeping, as there is a danger that you or your spouse may roll over baby and cause suffocation. Newborn babies do not need a pillow below their heads. Rather, a shoulder roll would be more appropriate. This could be placed below the shoulder and this would extend the baby's head so that baby may breathe more comfortably. Until your baby's cord falls off, it is preferable to give your baby only a sponge bath. Once the cord falls off, you can give your baby a complete bath. You can use any baby soap or shampoo which is available in the market. Other tips to keep in mind is try to restrict the number of visitors during this crucial time, because your baby is still susceptible to many infections. In case anybody needs to touch the baby, ensure that they use a hand sanitizer and then lift up the baby. After birth, babies are given 3 vaccines. The BCG vaccine, which is given on the left arm, polio drops which are given in the mouth, and hepatitis B vaccine which is given in the thigh. None of these vaccines will cause any pain, fever or discomfort for your baby. The next scheduled vaccination for your baby will be at 6 weeks. Speak to your doctor about getting a metabolic screening blood test for your baby. The metabolic screen basically looks for certain metabolic disorders such as hypothyroidism, which should not be missed in newborn babies and may not be apparent until later on in life. So ask your doctor and get a metabolic screen blood test done for your baby. Also speak to your doctor about getting a hearing screening test done for your baby. I hope I've been able to clarify most of your doubts. If you do have any more queries, do let me know in the comment section. And if you've liked this video, please click on the like button and share it with others who you think may benefit from this video. Also, please subscribe to my channel for many more such interesting videos.